Hi, Dr. Nick Seacrest. I'm here with Dr. Jen Sanford as my patient today. We're both with Elevation Now, and something we're going to talk about today is cranial adjusting. It's something I check on every single visit, is the alignment of the cranial plates in our head. Now, if you look at a cadaver or a corpse, and you looked at their skull, it looks completely fused. In real life, we have, within those sutures where our cranial plates meet up, we have microscopic nerves and blood vessels that travel through there. When we breathe in and out, there's a very, very subtle expansion contraction that takes place. Some type of therapist you may have heard about is a craniosacral therapist. And they're concerned about that flow of the cerebrospinal fluid, the fluid that surrounds your brain and spinal cord. So with cranial adjusting, it can affect a lot of different things, some of them globally, some of them different systems in our body. So with Dr. Jen showing you how I check cranials, then I'll explain which ones they are. I'm going to do muscle testing, apply kinesiology. I'm going to have Dr. Jen hold her arms strong. Hold strong for me. Good. And then all I'm going to do is really gently challenge the plates in certain directions. Good. Now this one I'm checking on the right, and then on the left checks for digestive issues. It's related to digestive issues. This one here, the front of Dr. Jen's skull and the back pushing together, hold strong. That can be sinus related. Going to the back of the skull here, her occipital bone, the base of the skull, I can rotate it one way, just very gently rotate it the other way. She's strong on both of those. That's in good alignment. If I push down on the top of Dr. Jen's head, that checks cervical compression. Is there any compression taking place throughout the neck? We can check her temporomandibular joint, the Tmj joint, and we can check the frontal bone. If I go right up here, I find this a lot in people where they have like a frontal or a sinus type of headache. So those are some of the different cranials that I check. Some of them deal globally with the whole body. Some of them deal with specific systems, the digestive system, the sinuses, respiration. Cranial adjusting is something that is beneficial along with getting your spine in good alignment, and it's something that's very gentle. We utilize the body's breath to gently unlock that mechanism and bring that subtle expansion contraction back to the craniosacral motion. So if you have any questions, give us a call, 970-263-9100. We're at elevationnow.com. Again, Dr. Nick Seacrest with Dr. Jen Sanford.